Hi, good night, Dorian. Thank you for being on time.
Good night.
Good
Yeah,
night. I really appreciate you are always on time.
I, yeah, don't worry about that. Yeah, I'm used to that.
That's great. That's a good habit.
Yeah.
Okay, let's wait to your classmates. They are not here, and well, maybe we can wait 5 minutes. Is that okay for you?
Okay, I have no problems.
Mhm. Okay, perfect. I'll be back in 5 minutes, okay?
Okay. Okay.
Hi, good night, everybody. I really appreciate you are on time. And well, thank you. Let's start with this class, okay? Because it's going to be so late and well, we all have some activities. Let me see. Good night, Pablo. Let me see. Can you watch my screen? Can you hear me without any trouble? Okay, perfect. So let's watch. This class is nice, I think. It's a very fast view about lots of important topics that I think are going to be so useful. We are going to talk about treatment, concept, differences between different kinds of treatments, and when it's a treatment and when it's not. We're going to check, of course, medical treatment and surgical treatment, and some therapies. With therapies, there are activities that help us to get better, to complete that treatment, maybe. But well, just a first view, because during the module 2, we're going to check most of these situations during the course, okay? Let's check. Medical treatment means the management and care of a patient to combat a disease or disorder. Okay, we all know when we receive a patient that has a situation, we have to take care of him. We must evaluate all the pathologies, get the diagnosis, and start medication, start taking care of all the situations that the patient is suffering from. No matter if they are only medical situations, we have to look for another situations too, for example, social situations. That's why we have medical allied professionals that help us to make the treatment in the properly way, to make the correct activities in order to improve the patient's situation, right? When we consider medical treatment, we have to know that it includes all treatment not otherwise excluded, all activities that are related to the situation that the patient is suffering from. We all know about it. We have to consider this. Well, medical treatment also includes using prescription medications or prescriptive medications, or use of a non-prescription drug at prescription strength, okay? Of course, prescription medications, for example, antibiotics, or non-prescription, for example, vitamins could be. According to the situation, we decide how important they are in order to add into the indications. Using wound closing devices, such as surgical glue, sutures, and staples. All of these devices in order to close all wounds and get better the patients, especially surgical patients, right? Using any device with rigid stays or other system designed to immobilize parts of the body. Cast, the splint, or many other devices that are related to these specific activities. Administration of oxygen to treat injury or illness. In the emergency room, we have, of course, protocols that let us to know how to administrate oxygen. And we have to study about it because we know that in order it's medication, we have to consider when it's really necessary or not. And then we decide the volume we are going to administrate, the device we are going to use, and all of these details. Exclusions from definition of medical treatment, situations that we have to know that there are non-medical treatments, and sometimes are getting in confusion. Medical treatment excludes the following items. Observation or counseling, visits to a physician or other licensed healthcare professional solely for observation or counseling. There are some patients that are admitted in the emergency room, because it's my own experience, and they have nothing. They just want to feel that someone is taking care of them. And well, we have to consider them and stay in the emergency room without anything for maybe 20, 40 minutes according to the situation, and explain to the patient that there's nothing to do at the moment, that the patient can go home. Okay, that's great. Other situations about this point could be a patient that is going to the emergency room or the consulting room asking for a lab test for making a control. When we decide to send that lab test, and the period of time that the patient is waiting for is not a treatment. It's a period of counseling, okay? Diagnostic procedures. Of course, the conduct of diagnostic procedures such as X-rays and blood tests, administration of prescription medication used solely for diagnosis purpose. I mean, eye drops for delayed pupils, or well, things like that. Situations that are not related to solve a pathological situation. All the procedures we develop. And of course, first aid, because as its name says, first aid, the first moment when we start helping a patient. It's not a treatment, because in this fast view, we have the chance to get a possible idea about what is going on with the patient, but we don't have certainly the diagnosis until get enough time for making the physical exam, the anamnesis, and maybe complementary tests, okay? These three situations are important to take in account, because while talking to patients or while giving a report, we must be sure that these situations are of course clear at the moment. The classification of the medical treatment, well, is this. Theoretically, there are three classifications, three ways to classify this. The curative treatment, when the objective is to cure a patient. The palliative treatment, to relieve symptoms from an illness. For example, cancer, we use analgesics or non-analgesic drugs in order to help the patient to avoid pain, for example, or preventative, to avoid the onset of an illness. Preventative is the first step in our career, because if we prevent properly, we have the chance to avoid lots of situations. That's why we study this topic the whole career, how to prevent situations, okay? Okay, when we decide that the patient we evaluate really needs treatment, and well, we have to give the indications, we send prescriptions and drugs, okay? When we talk in medicine, in medical English specifically, we cannot say recipe. Recipe is for cooking, okay? Recipe is when you give the list of things you need for cook. So give this difference so clear. Medical prescription is the term we use to give the proper information, to give the medication, to give the indication, okay? Prescriptions or medical prescriptions are the basis of our job, because we all have to write down this kind of medication, okay? As a part of treatment, a doctor may prescribe medication, commonly referred to as medicine or drugs, okay? We all know about it, just for getting in mind the correct term. A prescription may take these forms. The old style is handwriting, and the new style nowadays, the typing. We consider these differences because we got that trouble in handwriting, the old style, that in handwriting prescriptions, sometimes the handwriting is awful in our career. We all know about it. We are out of time. We have to take notes so fast, and our handwriting gets awful. So there were mistakes at the moment of reading, and that mistakes were a high cost in life of our patients. That was a mistake because even the drugstore seller or the doctor, the pharmacist who's giving the medication could understand that. And in so many countries, including Bolivia, in some health insurances, use the style of typing and printing for not making this kind of mistakes. In handwriting, we had the chance to use abbreviations or old terminology in order to make it faster. But if the doctor, the pharmacist who was for reading the prescription couldn't interpret it or was without the knowledge about meanings of these old words, old abbreviations, was not possible to give the proper indication to the patient. That's why it's non-allowed nowadays. It's not the best way to do it. Typing, of course, everything is clear. Abbreviations are avoided at this point. Maybe details that are common all over the world, for example, milligrams or tablets, maybe in that way. But just until that point, they are available. Using, for example, mire or staina or nocte, as you can see, it's not the same way. That's why now it's better to use in this, okay? Not just for consideration. This is an example, very clear. In UK, we got medical prescriptions or prescription to a chemist shop. The chemist shop is the place when you can go to buy medicine and you certainly need the medical prescription. And you say the chemist shop is the drugstore. Okay, it's different. Now, the chemist shop, okay, which sells a wide range of non-prescription medicines and other products such as cosmetics. And you say the same is with drugstores, okay, for dispensing by a pharmacist. Okay, the person who prepares the medicine could be, if they are handmade, but it's not the usual situation. The pharmacist usually is someone that gets studies into the pharmacy career and is prepared to understand all of these handwriting that are awful and is prepared to realize the differences in medication and maybe give some suggestions if something is possible to exchange. In hospitals, prescriptions are dispensed by the pharmacy. The same in USA, the drugstore and the department where the drugs are prepared. Well, the drugs are prepared for giving. In this paragraph, it says drugs are prepared because in the drugstore, in the hospital, or outdoors in USA, you have to go with your medical prescription, you have to give your health insurance number, and according to that, they check in the internet system, the medical system, and realize how many pills you need, and they prepare your own medication. It's labeled with your name, with all the things that are just for you. It's not as free. Here in Bolivia, for example, we have the chance to go to the drugstore, to the pharmacy, and buy anything without a medical prescription. Some drugs that are so delicate, we can say, so controlled, really need the medical prescription, the ID, well, details, documentation for getting the opportunity of buying this and a specific, a very specific specialty to send this medication, but it's so controlled with not too many medication. Antibiotics are by free, for example, and it's a huge trouble we have to take in count. Okay, but coming back to the point, the medical prescription, as I was telling you, not medical recipe, the medical prescription have, of course, common prescriptions that include the common one, prescriber information and signature, of course, same as in Spanish. Of course, patient information. Without name, it's not viable to send the medication. date prescription was written. If it's without the date, it's not possible to give the medication. The superscription, I mean Rx. We all know this symbol, but now we are taking the meaning, right? The superscriptions holds the Rx symbol, meaning they do, you take, or receive, okay? The inscription, it's medication prescribed. The subscription, the dispensing instructions to the pharmacist. The sign-up, the given direction or instruction to the patient, and special instructions that are optional according to the situation, right? This is an example when we got date, patient's information, superscription, inscription, subscription, signature or sign-up, the doctor's signature, and the register. This another example taking different details, for example, the doctor information and the consulting room with phone number, dates of the patient, the date of the medication and how many suppositories the patient is going to receive, the sign-up, how it's going to be sent, how the patient has to take it. This refill is for the drugstore, is for the pharmacist. In USA, you have the chance to get this detail. This medical prescription says none because the patient doesn't have the capability to buy the same medication again. If it says 1, 2, 3, well, any number in the back of this medical prescription, the pharmacist is sending his signature and showing how many times he's giving and sending the medication again. If it says, for example, 3, the patient has a chance to buy 3 times the same medication. Okay, Yao means how many times it's given. For example, none is just for once. It's one check. For example, 3, there must be 3 checks. If the patient wants to buy a 4th occasion the same medical prescription, it's not possible because the one that is receiving the medical the prescription is gonna check that there are three symbols, we can say, and then it's not possible to send it. It's the way they work in UK and USA. Okay, well, the information of the patient signature and the medical register. Common abbreviations while talking about medication, just about in medical prescriptions, are all of this. Of course, they are same when we talk about medical indications, when we are treating a patient into a hospital, patient that is admitted, right? We got, for example, the abbreviation, a very common one, the BID. Bis in die becomes from Latin, and it means twice a day. We all know the meaning of this because we have in practice, we guess while working and we catch that bit means twice. But the words that this abbreviation is coming from is this, bis in die, okay? All of these expressions are coming from Latin. We get the abbreviation as a fact and the meaning that we have to check. Capsula, caps, of course. The C with this symbol, like a hat, means with. It's very common to watch this in medical reports. See, and the symbol, the strange symbol, okay? For example, Pieran, pro Renata, when necessary, okay? Or quid, quartering die, 4 times daily. We know about it. We got these meanings, as I was telling you, by practicing. Or statim, immediately, okay? Please, this slide is very important because all of these abbreviations are being added to the ones we are studying from Module 1. Take them into consideration because I'm going to ask for this during homework, final test, and everything from this point, okay? Well, just as an example, the British National Formulary is the way that doctors have to give information and prescribing and administering the medication in UK. If you don't have all of these details into the medical prescription, that's why it's typing now, it's wrong, and you don't have the chance to send this medication, because if it's not complete, the pharmacist is not going to sell you everything. As an example, sulconazole nitrate, the indication why the doctor is giving you the medication, that's the diagnosis you got, the cautions you have to consider about it, the side effects, the occasional ones, and well, the situation according to the medication, the dose apply, how it works, okay, apply, how the patient has to take it, and of course, you receive the different names. I mean, let me go to the next for being clear. You get the commercial name and generic name. An indication, well, a situation that suggests a specific treatment, we know. The contraindication, a situation or sign that a specific drug or treatment should not be used, okay? The commercial name, we know, is the name that is, well, the purpose of this name is selling medication, right? Or combinations. And the generic name is the chemistry name in order to catch the proper medication. Could be a generic name with 5 commercial names in different factories. Well, you choose which one is better for you. An example for this, Prozac is the commercial name, and fluoxetine are proprietary and generic names for the same medication. Fluoxetine generic, Prozac commercial. Just as an example, okay. Well, some pictures. Okay, let's talk about surgical treatment. We know this when we get into the surgery specialty as students or maybe while working. We know that surgery involves that procedure when an incision with instruments is performed in order to repair damage or arrest disease in a living body. The patient is alive, so we have to be clear on this. Medical procedure involving an incision with instruments. Surgery is an invasive technique with the fundamental principle of physical intervention or organs or in an organ systems or tissues for diagnostic or therapeutic reasons. What kind of therapeutic reasons? Maybe the excision of a tumor or diagnosis for taking a biopsy, I don't know, from liver could be. As a general rule, a procedure is considered surgical when it involves cutting of a person's tissue or closure of a previously sustained wound, right? Let's take it in count. These meanings are important. Now, well, when a surgery has to be developed, we get in a specific place. We all know about it. And that place is the operating theater. Why it's called operating theater? When surgery was being developed at the beginning of its branch, specifically, med schools were just for men at the beginning, right? And the first surgeons were in the necessity to teach their pupils and med students, and of course practice at the moment. There were non-sterile situations, non-sterile instruments, and the place that it was developed was a theater. As a fact, you were in the middle of the room, there were lots of chairs around you going up, and all students were seated around you, surrounding the situation, and all people could watch at the moment how the procedure was developed. Operating theater, its expression, is now at the moment just for tradition, because nowadays we know that into a surgical room, we got sterile conditions. We got lots of care. We take great care to make sure the operation and avoid infections. I mean, we have to become free from microorganisms as much as we can. The surgeon and the assistant wash or scrub up, okay, and put on surgical gowns, mask, and gloves. Nowadays, we know we have to cover completely to protect ourselves and protect the patient from infections. The patient's skin is prepared by disinfecting it with antiseptic solution. We know about it. I mean, we receive the patient is placed on the bed, or the surgical bed, or the surgical table too. And then one of the assistants goes and washes all the region of the body that is going to be operated, and the surrounding areas, then applies the antiseptic solution, and then is covered with all the dressings that are necessary according to the place that the incision is going to be developed. This is known as prepping or preparing the patient. They are covered with sterile straps so that only an area of the operation is exposed. We all know about it. We had the chance to check this. This is an example how a surgeon is wearing now. At the beginning, surgeons were just by hands, just maybe if they were, if they had the idea of maybe washing hands, but no more than that. With the common clothes, they get to the patient, the operating theater, and were cutting by hands, by free. It was terrible. History says that they used a surgical gown, but they never wash it. That was a tradition. How surgery developed was the rule to try to stand up your surgical gown with the blood that was dry, and it was so hard. It was not possible to bend it. You were a great surgeon if your surgical gown stood up without taking care of this. It was so funny to read that, but realizing the risks, of course, there was so contaminated situations. So, well, almost all patients were dying after the surgery because of infections. We all know about it, but nowadays we have to avoid this, wearing like this. Okay, that's the way to do it. Well, talking about instruments, we have to realize all of these situations. We got basic surgical instruments. Plate thumb forceps, we all know about it. The rat tooth or thumb tissue forceps, you watch the difference. Then you got curved or mosquito hemostat. Okay, you have the functions just for getting the proper vocabulary, okay? For catching more vocabulary that are specific in this case. We got the Crail hemostatic forceps. We also get the Kocher or Ochsner hemostatic forceps, the needle holder, very important. All of them change in size. The needle holder has this group. This group is helping to apply more strength to the needle in order for not moving this. The Mayo-Higar needle holders, again, it changes the shape in this part, and that's why we have to be clear on this. We got the towel clamp. It's for the dressings, just for making the proper exposure of operative site, of the operation site, right? On the Alice tissue forceps, the bad hounds, again, for exposing the surgical area, for catching the dressings. The scalpel holder, of course, we all know, in different sizes, shapes according to the blade. the sharp scissors for cutting tissues, for making dissection, right? Again, myodissection scissor and medicine-bow scissor, we got both of them. The curved, blunt, and blunt scissors, well, all of them has always a specific objective for cutting, for making the dissection of a specific tissue. Medicine-bow, for example, is for soft tissue. Mayo could help us to cut skin and muscles. Okay. Well, the suture scissors, we all know about it, blunt. The blunt scissor, again, can dissect fascial muscle? Well, could be. Well, the Lister and bandage scissors, we got this ballpoint in order to protect the patient's skin. Well, as a general view, we got the blades in scissors or jaws when we talk about forceps, the joints, that both of them got joints, the shank, then the finger rings, the handle and the ratchet. The handle ratchet, handle ratchet is this big hole. This is the proper position to catch all of this instrumentation. So for getting the idea and how to catch the needle holder and the needle for making the suture, okay? The retracting and exposing instruments, we got all of these varieties. For example, the Deaver is this retractor, is manual. Well, we use it to open the abdomen and chest incisions in the big spaces, okay? And some Deavers are easily to move, to calibrate, we can say, according to the area we need to expose. We got the Belfour with blade, the Belfour and blade of them for showing abdominal procedures, and that's the way it has to be placed. At the beginning, we place the Belfour, the hands, we can say, the two arms, and then we set the blade for showing properly all the abdomen, okay? Okay, and now let's get to the operation as a fact. The operation begins when the surgeon makes an incision or cut. Previously, the first incision, the operation is not starting. That's the point of view. We have to be clear on this. At the moment the surgeon starts cutting, that's the moment when the surgery is beginning. The control of bleeding is very important, of course. A swab is a pad of cotton or other material used to soak up blood from the operation site. That swab usually is made by cotton, sterile cotton, and has a blue line. That line is for, well, if we take X-rays from the patient and a swab is into the body, we can check the line and we can realize that we forgot that swab into the patient. Okay. A sucker is a mechanical device which aspirates or sucks up blood from the incision, okay, from the body structure we are operating. The bleeding vessels are tied with ligatures or sealed by an electric current. I mean the diathermy. Okay. Drains may be inserted, there are drains, to carry away fluid which might act as a culture medium for bacteria. Drains are very common devices that we can find into the surgical wounds, and they really help to protect the patient. Various methods are used to close the wound. For example, sutures like this, also known as stitches, change according to the situation, okay? Or maybe every day, maybe twice a day, or if they get with blood, but they have to be changed because blood is one of the best cultures for growing up bacteria, for bugs, okay? This is just an example about an operation report. Here we got some words that are in blinken that are, in this case, we had a patient with a right inguinal hernia. Well, the type of anesthesia was a spinal anesthetic with local anesthetic, infiltration, incision, right inguinal, of course. The procedure. Here we describe how it's done. The external oblique aponeurosis was divided as the spermatic cord mobilized. The herniated sac was identified and separated from the spermatic cord. The hernial sac was then mobilized back to its neck when it was transfixed and the redundant tissue exists, right? The fascia at the neck of the spermatic cord was divided carefully, preserving the vessels. The genital branch of the nerve and the vasa deferens, okay. Thereafter, the posterior wall of inguinal canal was repaired into layers. Closure. The wound was closed in layers with exon suture material to external oblique aponeurosis and staples to the skin. All of this procedure is the basic one, is the easy way to do it. Please check the vocabulary and expressions, okay? For ensuring that this way of description is easy to catch and easy to make, okay? About therapies in general, we are taking in account radiotherapy and chemotherapy. Radiotherapy is the use of radiation in controlled doses to treat cancers, many kinds of cancers, okay? It works by damaging the DNA of malignant cells, and radiotherapy may be used as curative treatment, for example, to shrink tumors, as adjuvant treatment alongside or following chemotherapy, treatment with anti-cancer drugs used that are very common administration by fluids in lower doses as palliative treatment to reduce pain and other symptoms of cancer or disease, but not as a cure. Palliative just for controlling symptoms, of course. Now we got this. A radiologist, the specialist in radiology, determines the dose and the exact target of the radiation beams. Dosage is measured by grays, in grays, GY, and daily dose is a fraction, okay? Not the whole radiation at just one moment, no, of course not. It has to be divided in the period of time you have to use and then receive small doses in order to stand all of the situation. Radiotherapy can also be delivered internally by radioactive implants, such as needles, or by liquids, such as strontium for some bone cancers. Okay, usually the radiotherapy, the moment when you receive radiation takes no more than 15 minutes by day. That's why you divide how many radiation you are going to receive, and then they check how many days you certainly need for standing all of this procedure. When you receive this radiation, you get so exhausted, you get in pain. Okay? In this case, we are checking a patient with prostate cancer, and we are watching how the seeds, these seeds with radioactive source, are inserted into the body for acting all the time, okay? The specialist places all of these seeds, and through the time, the period of time they are going to work, they may control by X-rays. When they stop working, they got again to the surgical room, and all of these seeds are taken out, okay? How does radiotherapy work? Just some information. Well, in this case for lung cancer, we got this external beam radiotherapy or brachytherapy. When you get into the body, You freeze the tumor and then you take out all of the tumor, but it's just an example. It's for you, okay? Okay, now let's check a day in the life of a physiotherapist. We were checking in Module 1 in last classes that physiotherapists are so important allied professionals because they help us to control the patient maybe and help the patient to get back to their lives, maybe in a normal way or maybe with new capabilities according to the situation they were suffering from. We got two professionals, the physiotherapists, as a fact, the physios, and the OTS, the occupational therapists, okay? In that way, according to the situation, both of them have the same objective, to help patients to recover their kind of life or get better or improve their kind of life, okay? The objective, the well-being, that's all. In this case, we are talking about Sam. Sam is a hospital physiotherapist. She works mainly with patients who have conditions or injuries affecting the lower extremities, the lower limbs, such as fractures, torn ligaments, and cartilage tears. Most of her patients are referrals from other departments in her hospital. I mean, they are referred because they need the attention of a physiotherapist. She also works with patients in rehabilitation following orthopedic surgery. Okay, they are learning how to use again the limb or the structure that was broken, and they certainly need exercises, need to know when to continue, when to stop, for not getting into stress and get a stress fracture. Some are young people with sport injuries, and other are elderly people who have had hip replacements. Okay, you see? Among her therapies are manipulating, massage, and exercise to keep the joints mobile and to strengthen muscles. Of course, all of these activities, manipulation, massage, and exercises, have a position to be developed, have a procedure, a specific procedure that has to be done by a professional, not because I watch a video on the internet, right? Rehabilitating some patients means helping them to walk again using crutches or Zimmer frames. Okay, crutches or Zimmer frames. Then we got the pictures. Yeah, there are crutches. Could be wooden, could be like this, the modern ones in very, very soft material, or Zimmer frames. The Zimmer frames helping people to move by their own, so slow, without making too many efforts. Now let's watch the cognitive and behavioral therapy. Cognitive and behavioral therapy is focused in talking therapies, I mean, for mental health conditions. When we consider these mental health conditions, nowadays we know that it's is now more common than previous years to hear that we certainly need mental health care. Well, some years ago, it was like a taboo to talk about it, but now it's very common to check this, and we are getting so clear that we certainly need help in a period of life. Maybe because of stress, maybe because of traumatic situations, or maybe because of a disorder, we certainly need it. It aims to eliminate negative thoughts and change behavior in response to these thoughts. It can help with anxiety, panic attacks, depressive disorders, post-traumatic stress disorder, and chronic fatigue. Chronic fatigue is terrible, I'll tell you by experience. While finishing the pandemic times, the pandemic, well, almost all the pandemic, I was working in a big hospital here in La Paz, and I was one of the doctors who was getting into the rooms with COVID patients, just no other kind of patients, just COVID. And it's so difficult to see how people is dying, and you cannot do anything for helping them. It's so sad. And it's a cause of chronic fatigue to watch that all of your effort is not giving a response, and it's not easy. Certainly, therapy, in my own experience, helped me to understand that it was out of my hands. It was not my fault. And well, now it's over, right? That's why doctors, we certainly need therapy. It's not easy to, for example, to receive an accident and you make your best effort and there's nothing to do, and to see a patient dying in your hands, well, it's not easy to deal with that. Or maybe you assist the deliver, you receive the baby and something is going wrong and the baby borns dead, could be an example. Or borns with low vital signs, it's not possible to make the CPR, or maybe it's non-effective because the body of the baby is not receiving the maneuver properly, or maybe there is not the correct situation, well, and finally dies. It's so hard. Or maybe you have to assume a mistake. We are humans, we can make mistakes. I'm making that mistakes, of course. It's not the best way to act, but we are humans. We have to be clear on this. That's why therapy during our career is more than important, and we certainly need it. Therapy can be provided in face-to-face sessions, okay, like this example, so talking to the therapist, or maybe in groups, okay. But nowadays, it could be delivery by computer. That could be effective, okay. By personal, I prefer the face-to-face sessions because it's easier to talk in person. Well, in person for me, but it works, okay. It's more effective than counseling for some and can provide long-term protection against relapse, okay? We check the meaning of relapse. I hope you remind this. A return of symptoms after improvement. We all know about it. The relapse is so hard to deal with. Why? Because when you think that things are going great, you get back and you have to start again, as if start again from zero. That's why it's not easy to take it in count. However, patients must be committed to solve these problems and prepared to work on them between sessions. Of course, it's not just one session. When you think about cognitive and behavioral therapy, you need a period of time. It's a long process, okay? Let's go. And for tonight, that's all. Remind this, if you have choices, choose the best. If you have no choice, do your best. By my experience, during the pandemic times, we had no choice. We have to deal with something that was new. We only had one chance to make our best, to do our best in order for not getting in contagious and for taking care of our relatives, I think. Okay, thank you. Let me send you the poll to take attendance. Okay, it's open. Please start filling the pool and I'm gonna send the slides to the chat, okay? Give me a second, please. Okay, I send the slides. Please let me know as soon as you download the file. And great. Let me know. Same. Thank you for telling me that you followed the poll. Thank you so much. And now let me know that you got the slides, okay? Hey.
teacher, sorry. You know that I can't. Could you send me, please?
The slides. Okay, Jacqueline, there's
Yes,
no
because
problem.
I have problems always. Okay, thank you very much. Bye, teacher.
Okay, no worry. You're welcome. See you. Okay, thank you. See you tomorrow in the workshop. Don't worry about it. Okay, thank you.
Dr. Iris, can you send me as well in box, please?
The slides inbox. Okay, Jimena, there's no trouble on this. No worry.
Okay, thank you very much, doctor.
Okay, see ya. Have a great night.
Thank you. Have a great night as well.
Thank you. Bye-bye.
Bye, doctor.
Bye-bye. Okay, that's all. I think well, everything is done. So see you. See you tomorrow during the workshop. Have a great night.